So, Tim, you're here today. How many weeks after the operation?
It was in, I can't remember, I think early September.
Early September, right? And obviously the reason why I'm doing this video today is because you do have a very unusual story, because you came to me as a second opinion, right?
Correct.
So you had surgery somewhere else.
A year and a half ago.
A year and a half ago, right? And it was your Achilles tendon.
Correct.
And you
and
had
a bone spur.
And a bone spur, right? And basically the doctor opened you up and removed the bone spurs and repaired your Achilles tendon, and you had a couple of bone anchors there too, right?
Correct.
So basically your story was very interesting because you went through all this, which is pretty traumatic because you were non-weight bearing for 6 weeks, and then you probably had to wear a boot for, I'm guessing, a couple of months, right?
Correct.
And you still had pain after the surgery.
And a lot of inflammation.
And a lot of inflammation, right? And we even had to get an MRI to ensure that you didn't have more than 50% tear in your Achilles tendon.
Correct.
Because if that was the situation, then TenJet would be out of question.
Right.
So we did the TenJet procedure, which is, this new procedure that I'm in love with, right? My husband is jealous, but I love this procedure because basically it provides a minimally invasive approach to chronic Achilles tendinosis and tendinitis.
Mm-hmm.
And so you're here today, you're 2.5 months after the surgery, right? So how was your experience so far?
Well, the surgery was almost a non-event, really, because, as you said, it was minimally invasive, so it didn't have an open, it didn't have any of that kind of stitches.
Right, you didn't have the scar that you had from previous surgery.
So from that standpoint, it was an easy pass. It was an easy go. The recovery took, perhaps, you get optimistic, so the recovery took a little more than I thought it was going to take. But the combination of time plus physical therapy has made, I think, a dramatic difference. So I feel.
So at 2.5 months, you feel like it was definitely worth your time?
Oh yeah, yes,
okay.
Yeah, better than opening up again.
Right, so, exactly. And can you imagine, it's hard enough to talk somebody into original surgery, but then what are the guarantees that revisional surgery is kind of like doing the same thing and expecting different results, right?
Right.
Isn't that what Einstein said is a definition of madness?
Correct. Not sure it was Einstein, but yeah, you're right.
It was, actually. I looked it up,
okay.
Yes. But basically, the reason why we're doing this interview is for not only people who have chronic Achilles tendinitis and are looking for alternatives to open surgery, but also show that even revisional surgeries in complicated patients, basically can be done to try to do the minimally invasive procedure and see if we can repair the tendon without opening you up.
I understand.
Listen, yesterday I did my first open case in a while, and I just forgot how brutal that surgery was comparison to the TenJet procedure. Yeah. I mean, TenJet is, you didn't even have a stitch, right?
Correct.
So, and how was the pain after the surgery?
It was for 2 or 3 days, I was aware of it, but it was not. I didn't need to take any of the opiates. It was an easy post-op recovery.
So you would recommend it for people who are,
Yes.
Okay.
Yeah.
Perfect.
Yeah. Unquestionably.
All right.
Yeah.
Well, thank you. You've been a great patient.
Thank you.
And we're doing your right foot, right? In January.
And you got me coming back for repeat business.
All right. I like it already.